What questions or problems are you working to solve?
The problem I'm most trying to solve is health for all. Notice I said health and not health care, because I believe in a very utopian way that if we are all healthy, and I mean physical, mental, and social health, just like the WHO defines it, that if we're all healthy, we're more productive, and then there's more fulfillment, less crime, and we are more innovative as a society. So I would really like to work towards that. And my little two bit focus in that is really, as from my pharmacist training, is to focus on medication use outcomes, and as an educator to also create awareness. So to really think about what kind of problem I'm trying to solve, I look at it in three ways. One is access to medications, the second is awareness, and the third is accountability. So when I say access to medications, looking at, for example, is there access to evidence-based treatments that are useful to patients, right, with acute and chronic conditions? Since about 70% of healthcare right now, the treatments are medications. So we need to make sure everybody has the access to the medications they need. And so my focus has been to find out what are the barriers to that access. So those barriers, which we now define more as social determinants of health, is really looking at, is there barriers like food insecurity, transportation issues, housing instability, neighborhood and built environment? Are these causing barriers to access so that patients or our individuals are not able to access those meds? And so we are right now working on trying to examine that in the unhoused populations in Southern California, where we are actually going into the streets and finding out from the unhoused population what are their challenges and trying to address that. The thing related to that is awareness. So first of all, awareness that they need to go seek healthcare if there is an issue, if they're seeing signs and symptoms, if there is some level of preventive and maintenance healthcare. So there needs to be awareness of first accessing the healthcare system. Then second, if you're provided meds, if you're prescribed meds, knowing why you need to take it, how you should take it, when you should take it. So really understanding how to take that medication for its best effectiveness for your healthcare outcome. So that is the awareness. And we are trying to create awareness through my research in various ways. One is to examine those barriers and then try to address those barriers. The second is to make it easy for patients to understand their medications. So we have now working on modifying and simplifying medication guides, what we call leaflets, which are given with every medication. So we have made it an infographic question and answer format. We are having it in different languages, and we have tested it, and we found that patients really find it much easier to read those and understand those. And we are also trying to now innovate into something like a bot or like a chat bot or a QR code, so that patients can have easy access to that instead of always looking at the whole paper. So those are some things which we're looking at from the perspective of awareness, and also we do a lot of patient awareness research to see what works and what helps retention most. And then at the third end is the accountability. So we all know that no matter how good the technology, how good the providers, if patients don't take their meds, it's not going to work. So really helping patients with adherence, and that's been another focus of my research, has been understanding how patients are adherent, who's really adherent, what is it? Is it related to their personal responsibility, which we call accountability? Who's non-adherent? So if they're non-adherent, what are those barriers? Can we address them? And is there an education issue or literacy or awareness issue? Can we address them? And then the third aspect is there a sense of personal responsibility, really saying that finally, your healthcare, you have a place to play in that, and you need to be more accountable for that. And we're also trying parallel in terms of medications, not just providing medications or helping with meds, but also saying, okay, what about lifestyle modification? So food is medicine, exercise, movement, mental health. So we're also looking at all those issues. So really, if you put it together, really trying to examine how we can help people get healthier, and with when they are actually doing it with a sense of understanding it, buying into it, and then with a sense of personal responsibility.
Why have you chosen to pursue this question or problem?
So, as I mentioned before, I've chosen to work on this problem because I believe that we all need to be healthy, and of course that's why we all come into healthcare. But also making sure that people have equitable access to all those things we're trying to provide. And when we don't have equitable access, there are issues. So what we now call pharmacoequity, so making sure that everybody has access to effective treatments, and that's kind of the focus. And why I do this is, I think it's kind of a multiple approach almost, because I'm an educator. So as an educator, I'd like to make sure that the students I'm with in class with, the students, I'm teaching them not only the content of the information. So I teach health systems and I teach practice management. So how to be a better pharmacist. So the focus is to have our graduates, our pharmacists, be the best they can be, and also be personally and professionally developed with self awareness and their own sense of wellness, to understand that if you are well, then you can provide better care to your patients. You need to be also healthy and well. So, focusing on not only the content of all what I teach, including health outcomes, but also trying to make our students into better pharmacists. So, also longitudinal leadership curriculum. So, why I have chosen that problem, coming back to it, is really to help everyone understand the perspective of healthy people, really, and that's even a national focus. So, as an educator, I'm trying to work towards the research, and as someone who's a professional, I also work in a lot of service engagements where active at the national level. I'm currently the AACP president, where we're trying to incorporate all these in all our schools, a sense of personal and professional identity and a focus. And my theme, as you can see at the background here, is reach out, engage, and elevate. So my focus is really to reach out to everyone and make them feel heard, loved, understood, included, engage them in the conversation together, so that collectively the goals we have we can work on and elevate all of us. So why I have chosen again this problem is, or this issue, is because of its very far reaching impact, because health is so important and integral to us, and I'd like to address it from awareness, so education, from the research, and from making everyone accountable.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
I think everyone can do their own bit with whatever strengths and skills they have. So, as I mentioned, so I have chosen the path of education, research, and service. And in my education, I work with students. I also precept them, and I make sure that I transfer as much as I know about how to help with this whole issue. As a researcher, I'm using, I build models and tools and questionnaires on measurement. We have one which addresses, or one which we are trying to figure out all the different barriers to adherence. We call it CATCHA, or Comprehensive Assessment of Challenges to Adherence. We're also looking at patient satisfaction with pharmacist services. So I have various tools, an accountability tool. So this is the research, and my research is focused on structure, process, outcome, looking at the structure of a certain issue. How can we change the process towards outcomes? So it's very patient driven and patient focused. And I also look at economic, clinical, and patient reported outcomes. from my service responsibility, I'm trying to make sure that I'm active in state and national associations so that we can all work together. So, in response to your question on how can we all help, I think we're all interconnected. So, as we collaborate, as we work with each other on research, on education, on the practice side, as part of it, we can also work with policy changes, regulatory changes, which help. So we have the ECAPs in pharmacy where we are trying to have access for everyone to meds. We can also look at it from a perspective of um, funding, so the funding bodies, and also trying to get grants. The people who are involved in the research, and then the people who are also involved in working with all kinds of populations, and like we have the CHWs. So I think everyone within their education, within their skills, within their strengths, can do something to collectively do a better job with this. And the one thing I also wanted to mention is we can innovate. So part of why I'm in academia and as an educator is this is the place where we can really innovate. We can test models, working with other agencies. So we work with funding agencies, work with policy agencies, work with health plans. We work with pharma. So we are able to test certain models which can help improve and which can be mutually beneficial. For example, we run a telehealth center, which I founded at my institution, where we are working with patients who are not as adherent to the medications, and we counsel them and we try to get them, being monitored and keep their health goal. So I think each of us can do whatever is within our ability towards this one issue that I'm trying to resolve.